Listen to this. It's a quote from a very experienced surgeon. Day 5 tachycardia after bowel surgery should scare you. That's it. No more context, just this really stark warning. It sounds pretty ominous, right? It's the kind of statement that just hints at some hidden danger, a catastrophe that's lurking just beneath the surface of what seems like a normal recovery.
So that's the big question, isn't it? How can something as common as a fast pulse be the one single sign that saves a patient's life, especially when everything else seems to be pointing to a totally normal recovery? Well, that's the medical mystery we're going to unpack today.
So we're going to dive into a fascinating case study that shows exactly how one very subtle clue, this tachycardia signal, can be the key to stopping a disaster in its tracks in those critical days right after a major surgery.
All right, let's set the scene. Imagine it's the morning of the 5th day after surgery for a 72-year-old patient. We'll call her Nancy Williams. She's supposed to be on the mend, getting better, but the morning check-in, it reveals something deeply, deeply unsettling.
Her vitals here are telling a story. Yeah, her temperature is up a bit, her blood pressure is starting to dip, but the one thing that just jumps right off the page to a trained eye is that pulse, 112 beats per minute. That's tachycardia. Her heart is absolutely racing, and it's basically screaming that something is critically wrong somewhere inside her body.
So the senior surgeon on the team, he sees that heart rate and there's no hesitation. While maybe some others are thinking, lung infection, maybe dehydration, his gut, his experience tells him to immediately suspect the worst case scenario. And he just says, think leak. He thinks the surgical connection in her colon has failed. So why was this particular surgery so risky to begin with?
To really get what's at stake here, we've got to rewind the clock a few days. We need to look at who Nancy is, medically speaking, and understand why her surgery for colon cancer was so much more than just a routine operation. You see, Nancy's body was already fighting multiple battles before she even went into the operating room. She had diabetes, obesity, anemia, low protein levels. Every single one of these conditions makes it significantly harder for the body to heal itself. It's kind of like trying to build a house during a hurricane using shodding materials. The foundation is shaky right from the very start.
Okay, so here's the deal. The most crucial part of the surgery involved creating what's called an anastomosis. So after they removed the cancerous piece of her colon, the surgeons had to join the two healthy ends back together. Just think of it like you're a plumber repairing a pipe. It has to be a perfect, absolutely watertight seal. And for Nancy, with all of her underlying health issues, getting that seal to hold was the biggest challenge of the whole thing.
Now, let's fast forward to her recovery after the operation and see how this all starts to unfold. Because for the first few days, everything looked fine. And honestly, this is what makes this story so chilling. The disaster was brewing in plain sight, but it was disguised as a perfectly normal recovery.
The timeline of her recovery is just so deceptive. Day 1 and 2, totally stable, nothing to worry about. Day 3, she gets a little low-grade fever, but hey, that's pretty common. They figure it's from a little bit of lung collapse after surgery. Then by day 4, she's a bit uncomfortable, but again, nothing that's screaming emergency. It all looks like a textbook recovery.
And this slide really highlights that classic problem in medicine, trying to find the signal in all the noise. On day 4, the team's official diagnosis for her discomfort is something called post-operative ileus. Basically, her gut has temporarily gone to sleep. Super common. But a junior resident notices something else, just a tiny little signal in all that noise. He notes her heart rate is creeping up.
And her pulse on day 4 was 96. Now, that's not technically tachycardia, which is usually defined as over 100 beats a minute. It's right in that gray zone, so easy to dismiss, so easy to explain away. But it was the first tremor before the earthquake. It was the very first sign that Nancy's body was starting to fight a secret battle. So, why does the heart race? What's the biology behind this critical signal? To really get why that senior surgeon was so alarmed, we need to look at the chain reaction that kicks off inside the body when that surgical connection, the anastomosis, fails. Okay, so when bowel contents leak out into the normally sterile abdominal cavity, it triggers a massive infection. The body's response to this invasion can just spiral out of control, and that leads to a condition called sepsis. And sepsis isn't just a bad infection, it's the body's own immune system overreacting so violently that it actually starts to attack its own tissues and organs. It is a full-blown medical emergency.
So let's trace this chain reaction. The leak causes massive inflammation. The body responds by releasing this flood of chemicals called inflammatory mediators.
These chemicals basically hit the big red panic button on our sympathetic nervous system, the fight or flight response. And what's the very first thing that system does? It tells the heart to beat faster, to pump more blood to the tissues. Tachycardia is often the very first, most sensitive sign of this oncoming septic storm, and it can show up even before a high fever or a big drop in blood pressure.
And this is why day 5 is the magic number. See, for the first couple of days, the stitches or staples are holding everything together mechanically, but right around day 3 to day 5, the body starts to remodel that tissue. Enzymes actually break down the old stuff to lay down new, stronger tissue. And during that very brief window, that connection is at its absolute weakest. If a patient's healing is already impaired, like Nancy's was, this is the exact moment it's most likely to fail.
So, let's get back to Nancy on the morning of day 5. With the surgeon's suspicion of a leak now on the table, the team just kicks into high gear. They are no longer managing a recovery, they are literally racing to contain a catastrophe.
There's absolutely no time to wait and see what happens. They rush Nancy for an urgent CT scan with contrast dye, and the images that come back? They're totally unequivocal. The surgeon's worst fear is confirmed. The anastomosis has leaked. The CT scan gives them concrete proof. There are air bubbles where there should be no air. There's a pocket of infected fluid collecting in her pelvis. And the most damning evidence of all, you can actually see the contrast dye they injected leaking right out of the colon. The pipe has burst.
Nancy is rushed straight back to the operating room. The plan is aggressive, but it's life-saving. They have to drain all the infected fluid, wash out her entire abdominal cavity, and then they have to create something called a colostomy to divert waste away from that failed connection, giving it a chance to heal. It's a massive intervention, but it's the only thing that can stop the sepsis and save her life.
So what's the big takeaway from Nancy's harrowing experience? Her story isn't just about a medical complication, it's this incredibly powerful lesson in clinical vigilance, and really, the art of listening to the body's subtlest signals.
And thanks to that team's quick action, which was all triggered by that one single vital sign, Nancy survived. After 2 long weeks in the hospital and that second surgery, she finally went home. Her recovery was long, but she made it. A life was saved because someone understood what a racing heart was trying to tell them.
And that brings us right back to where we started. The senior surgeon later used this exact case to teach his junior doctors. And his point was simple. Textbooks, they give you the averages. But patients give you clues. That rising pulse was the only clue Nancy's body gave that she was deviating from the textbook recovery. And that one subtle signal, when it was read correctly, made all the difference in the world. This whole story really makes you wonder, doesn't it? I mean, if a heart rate just creeping up from the 80s into the 90s can be a signal of a life-threatening emergency, what other quiet signals might our own bodies be sending us every single day that we, or maybe even our doctors, might be missing? What's the real signal and what's just the noise?